Hi, welcome to the COVID-19 Lake Norman and North Mecklenburg briefing call. Today is Monday, March 23rd. My name is John Bradford. I am your briefing call moderator. I'm a small business owner right here in North Mecklenburg. I'm also a former member of the North Carolina House of Representatives, and I'm going to be moderating this call today. The purpose of the call is to bring together healthcare experts, government officials, and business leaders to provide regular COVID-19 briefings to update and support the Lake Norman community during the COVID-19 outbreak. The message here on your screen, this is from the President's desk, 15 days to slow the spread. The focus here is to try to slow the virus down. If you feel sick, please stay home, do not go to work. If your children are sick, keep them at home. If someone in your household has tested positive for the coronavirus, please keep your entire household at home and contact your medical provider. If you're an older person, please stay home and away from other people. And if you are a person with a serious underlying health condition that can put you at an increased risk, please also stay home and away from other people. You see two resources on the screen here, cdc.gov and coronavirus.gov. Here's a heat map of the United States. We have over 15,000 active positive cases of coronavirus in the United States. And you can see North Carolina is not the darkest color orange, but it most certainly is not the lightest color orange either. There's a website that FEMA has started. They're calling it FEMA Rumor Control. The purpose of the FEMA webpage is to help the public distinguish between rumors and facts regarding the response to coronavirus pandemic. We know rumors can easily circulate within communities during a crisis, and FEMA wants everyone to stay informed with their updated myth versus facts related to the response. And as you can see on the screen, there is the website address for it. Just to cover a few of their Q&As here in terms of the rumors. Myth, there's a national lockdown and the entire country will be quarantined for 2 weeks. There is no such lockdown. Myth, FEMA has deployed military assets. No, FEMA does not have access to military assets. Those are usually at the discretion of governors for the National Guards and, of course, the President of the United States. Myth, I need to stockpile as many groceries and supplies as I can. FEMA saying, please only purchase what you need for you and your family for a week at a time, because there may be other families that are unable to buy and stockpile food. Myth, I heard that the government is sending $1,000 checks. How do I sign up? The U.S. government is not mailing checks in response to COVID-19 at this time. Anyone who tells you that they can get you money now is a scammer. So please do not fall for that and make sure you're getting information from trusted sources. And then here's the last myth. Only those over 60 years of age and those with existing health problems are at risk of coronavirus. That is a very unfortunate rumor because there are, yes, while people who are older at higher risk, there are ranges of symptoms for all different range brackets. So do not just think that you're safe if you're under 60 years old. That is a myth. Just a couple things regarding the state of North Carolina. We're still under a state of emergency, which started back on March 10th. You can dial 211 and you'll reach a United Way resource hotline. That's for all kinds of resources, but no medical advice at that number. You can also text COVID-NC to 898-211 to get regular updates. You can see that right here on your screen. And there is a COVID call center. And then, of course, you can go to the North Carolina Department of Health and Human Services website. The governor of North Carolina has issued 3 executive orders related to COVID virus so far. Executive Order 117 was closing K-12 schools for 2 weeks, and that any events greater than 100 people must be canceled or postponed. Executive Order 118, it closed restaurants and bars for dine-in service, and it also made unemployment benefits more widely available. And then Executive Order 119 waives restrictions on child care and elder care and provided Department of Motor Vehicle flexibilities. There is no shelter in place currently for North Carolina as of this call, which is 12:30 on March 23rd. The North Carolina Department of Public Safety is seeking input from businesses who believe that they may qualify to be exempt in case such an order is put into place. So if you have good reason to believe your business should be exempt from a shelter-in-place order, then right here on your screen, you need to shoot an email to this address and include your business name, your website address, point of contact, and the nature of your business and why your business is critical to continue operations. So if you're a business owner, please pay attention to this slide and be sure you send an email if you want to be exempt from a shelter-in-place order. North Carolina is seeking healthcare volunteers. North Carolina Department of Health and Human Service Secretary Mandy Cohen has said we need clinical physicians, advanced care providers, nurses, EMS, clinical support such as pharmacy, imaging, and respiratory care, and non-clinical support like facility maintenance, safety, and administrative personnel. And if any volunteers have medical supplies that they're able to present, including personal protective equipment, there is a website on this page through the North Carolina Training, Exercise, and Response Management System that you can submit a form. So if you are in a position to help and qualify, please go to this website and do so. North Carolina is counting on you. By the numbers, we have 297 cases in North Carolina. We still have 0 deaths in our state, which is great news. We've completed over 8,400 tests. There are 15,219 U.S. cases, and there have been 201 deaths here in the United States from COVID-19. And you can see the heat map. We're starting to see other counties affected with darker areas of blue here in North Carolina. And Mecklenburg County does have its own heat map out. You can go to this website that you see on the screen. You can see the affected areas. Most of our zip codes in Mecklenburg County do have at least 1 case identified. There appears to be 3 zip codes, Davidson included, that does not have a case yet, but it does look that there are cases starting to pop up in most of Mecklenburg County. And it's interesting, if you look at this last slide here, the age group that is most heavily impacted is 20 to 39 years old. That sort of proves that this is not reserved for those 60 and older. And it's about 50-50 male and female. It's 43% white, 35% black, and about 4% Hispanic, and then there's a few others. All this is right here on the slide in front of you. Congressman Alma Adams of the North Carolina 12th District had planned on joining our call. As I was getting this call started, we got a note from her, one of her assistants, that she just got pulled into something else. Alma's office, or Congresswoman Adams' office, did send me this slide. She's having a teletown hall tonight, March 23rd from 6 to 8 p.m. You can join the call. There's a phone number on the screen and an extension. So please feel free to join her teletown hall tonight on coronavirus. Congressman Murphy, have you been able to join the call? Okay, Congressman Murphy texted me that he also is balancing another call. He may or may not be able to join. He's a Davidson alum. He is a medical doctor. But we do have Dr. Jack Faircloth, who is a doctor right here with HMD Group, HMG, here in Huntersville. Dr. Faircloth, if you would mind giving us an update, that would be most appreciated.
Sure, thank you for the opportunity. So, as you said, all of Mecklenburg has at least 1 zip code there's at least 1 case per zip code in Mecklenburg County to date. So it's here. My other talking point would be anxiety isn't helpful. Concern and knowledge about this is. So what can we do about our anxiety? 3 is how to explain COVID-19 to kids so we can all keep peace in the home. And then last is what are the facts? So let's start with number 1. You made an excellent point that 50% of cases in Mecklenburg County, we have 80 total in Mecklenburg County, 50% are ages 20 to 39. Those are not the ones that will need our overtaxed healthcare system. So we are asking and expecting out of the community that we all do more and more isolation, preparedness at home, and expect restrictions like the shelter in place nationally. Like you said, it doesn't mean go and buy more than a week's worth of food or medicine, because no matter when that order, if that order comes, we will all go out for medicine and food and to check on loved ones. Anxiety isn't helpful. We know it isn't. The name of this virus, novel coronavirus, means new coronavirus. But that doesn't mean that pandemics or even war is new to our history. We need to realize that this virus is new, but how to get through it is not. So let's all take a deep breath and listen carefully and adhere to what our experts are telling us. To lessen anxiety, this is what patients should do. Take breaks from the news. increase their phone calls to loved ones, use other forms of digital connections like texting or video chatting to your loved ones. Make a time to get exercise daily, eat healthy foods, play games, do puzzles. I still had a beer with friends 6 foot apart on Friday, and it really helped. We all know that this is tough, but ways to explain it to our kids. One example I've heard so far is the game of dominoes. If you just show your kids a line of dominoes and tell them that the new sturdy dominoes represent the young and healthy in our community, people, but imagine a very precious, brittle domino made of crystal. That represents the sick and the older person, such as their grandparents. If all the dominoes are too close and we push in a line, then eventually the spread of the virus knocks over all the dominoes and some would break, which are the ones we need to be thinking about. If we just spread out, isolate, and are prepared, then the young can get this virus, it looks like, and get right back up, and the game continues. So we just need to think about explaining more to our kids and checking in with them. Last fact. France released a study yesterday that showed that using 2 antibiotics that are not quite widely available, but we have, using both together gave a cure rate of 100% in 5 days for COVID-19. Now, it was a very small study, so we don't expect all people to be cured if they get both of these medicines, but it tells us we have something to use. It tells us that healthcare workers can take this medicine up front and keep working, and the elderly may eventually have the supply from factories to get this medicine. Pandemic lasts about 3 months. Italy is 1.5 weeks ahead of us. Italy is also 3 weeks from its peak. The message really is just this in simple terms. The number of vulnerable people, those precious, fragile dominoes that could fall, is way more than our hospital systems can care for. We have amazing things in place. We have a virtual hospital that is open. We are treating people in their home as we speak with every single thing they need. All medical offices have cleared their schedule. We are calling in meds and receiving calls. But we need every person in our community to be on our healthcare team, spread themselves out, and to stay calm and know that we'll get through it. Thank you.
Thank you, Dr. Fairclough, for that. I do know that Dr. Greg Murphy, one of our congressmen here in the North Carolina 3rd District, is on the call, and also a Davidson College alumnus. Dr. Murphy, I'd love to hear from you, just both from a medical perspective and what's going on in Washington, D.C. Dr. Murphy?
Hey there, John, you there?
Yeah, there you go.
Hey, I'm sorry. Thanks again, John, for doing this. This is tremendous. And Dr. Fairclough, very, very good words. I've spent the last 96 hours pretty much nonstop on phone speaking with experts around the country, epidemiologists, et cetera, and my congressional colleagues about this. In fact, I'm supposed to be on a conference call right now in just a couple minutes with our congressional colleagues. Bottom line is we're in uncharted territories. Mistakes are going to be made. I think that our ship is moving in a very, very good direction. In Washington, D.C., the Senate had some really good stuff going on. Unfortunately, there's some political partisanship in there right now and trying to put things in a stimulus package bill that have no reason to be in there whatsoever. We need to get a relief to American families. We don't need to worry about some of this extraneous stuff, but that's a whole different thing. I will just tell folks that we are going to get through this. The next 6 to 8 weeks are going to be tough, and I'm telling folks to make sure they go out if they can and order takeout from their local restaurants. And you know, Dr. Fairclough said it's important to call our elderly, make sure that they know that they're loved and cared for, but make sure they stay home in place. I've spoken with our state leaders, HHS, and in fact, I think there's going to be a news conference today. We need to keep people out of gyms. We need to keep people out of any type of communal area that at all possible. You know, It's going to be at the soonest 9 months until a vaccine is available, probably more 12 to 15 months. But the best thing that we can do while we're waiting to see what these other trials of these other medications show, which won't be back until at least mid-April at the very, very soonest, is just to keep one another apart and actually be smart about this. Unfortunately, a lot of folks either don't know or not heeding these messages. And if we're going to be anything like flattening a curve like Korea, Singapore, Hong Kong did, that's the only way we're going to do that. It's with social spacing. So, John, I really appreciate this, that you're doing this, getting the word out. It shows great leadership. I hope we can get you back in the House because this kind of thing for nonpartisan is so crucial to educating our communities. And thank you again for having me.
Yeah, thanks for joining so much. We're now going to take it over to Mecklenburg County Commissioner Pat Cotham, who's going to give us an update on Mecklenburg County, and I also think she's going to give an update for CMS today. Commissioner Cotham, are you on?
Yes, I am. Thank you very much for inviting me. I do want to start with the county commissioners statewide are having two important phone calls. One today at 5 o'clock with Speaker Moore from the North Carolina House, and one tomorrow with our governor. As long as I've been a commissioner, this has never happened. So I'm just thinking that we could be having, more stringent rules coming from Raleigh. So, but anyway, I'm glad that they're going to reach out to the county commissioners, and I believe they're also reaching out to leaders in the towns across the state. So again, one is today at 5 and one is tomorrow around 1:45. A few up the map that you showed about the county. I'm glad you showed that, and I'm glad that was made by Mecklenburg County, and that does show how it is spreading around. And Davidson seems to be, one zip code that doesn't have any, but that could change, in a day or so. And emphasizing about the ages, it's not just, older people, it's younger people too that are being affected. Some things that are happening in the county that I think will be beneficial to everyone to know. We have deferred payments of gross receipts of taxes for 60 days. Now, we're also going to absorb the fees, and this will also give people, besides more time, and they can pay things online. And so we're happy about that. Now, that's not sales tax. Sales tax is collected by the state. And then they funnel money back to the counties, and then we funnel it to the cities. But this is the other kinds of taxes, like the taxes for tourism, the extra tax we paid for prepared foods and rental cars and things like that. We've also seen a 100% increase in the number of online applications for food and nutrition in the last couple of days. So, but we are getting that done so that they can get the food they need, and we're having good luck with getting that done online. The county manager is working with the city manager of Charlotte for an infrastructure for small business, for loans to help small business. This will be a countywide thing that'll help small businesses with no interest loans so that they can, stay in business. And we do, thank goodness people have criticized us over the years that we have a large fund, and, this is what we've been having that money for. So I'm happy about that. And I don't have many details about this, but they are working toward that. We also are working with landlords to waive rents to help people, and the county is through nonprofits like Crisis Assistance. We are giving crisis assistance. We're going to fund it and giving crisis assistance ways to help people if they are right now facing eviction. Even though evictions are going to be held off, but just to pay their rent, we're doing that for 1 week. I'm sure we'll probably renew it, but that's something that we're doing to help them to take the pressure off them. You talked earlier about the gyms that being closed. We did have some problems with some gyms that were not closing, and and they closed after they had calls from CMPD and the media showed up. So we are getting that in control. And if people see things like that, please either contact CMPD or they can contact me and I will get that handled. The sheriff has, by the order of Chief Justice Beasley of the Supreme Court, has stopped evictions through April 17th. And that is very helpful. And the sheriff, the county has rented 2 hotels with totaling close to 300 rooms for people who are homeless, who get sick and need to be isolated. And the sheriff has offered to transport people, any homeless family or individual who needs to be transported to one of the hotels. And we're looking for more hotels. So that is helpful. I want to brag about CMS and also Rhonda Lennon, who represents North Mecklenburg, was the leader on this, is that CMS is sending school buses through neighborhoods, mostly in North Mecklenburg, to provide food for kids that have not had access to it at our current feeding sites. And last week, CMS had 22,000 meals to kids, and those are our teachers and school workers that are getting that done. That's an enormous project, and that they're being very successful. We also have 10 child care centers we've opened for our first responders and our hospital systems. And I think we have 800 kids in it now, and we're trying to expand that. And just in closing, I advocated for, because there's so many places closed uptown, that restaurants and the libraries where our homeless neighbors use the restrooms. And so we now have porta potties uptown with hand washing stations to help our homeless neighbors have some dignity. And so those are the highlights from Mecklenburg County.
Thank you, Commissioner Coughlin. Thank you for all what you're doing, and really appreciate you being a part of this briefing panel. Now I'm going to turn it over to Cornelius Mayor Woody Washam. Woody, the line's yours.
Thank you, John. Appreciate being a part of this call as well. I think it was stated somewhere along the way that Mecklenburg County is currently at 97 cases. In Cornelius, it appears that we have 1 to 3 cases based on the map that we addressed earlier. Our town facilities are closed as of Friday the 20th. However, our staff does remain at work with appropriate social distancing implemented as they work. Our town parks and greenways remain open and are quite active. I was out there yesterday at Jatun Park, and it was so busy they had to open up an extra parking lot to house all the cars. However, in order to protect the public within the town parks, we're implementing the following measures, which I'll go over to try to add some protection. We're strongly encouraging the patrons to keep at least 6 feet apart, and such things as shooting basketballs solo and not playing group basketball games are things that we're encouraging. We're closing our bathroom facilities and playgrounds due to the difficulty in keeping these adequately and sufficiently clean and sanitized. Also, our budget workshop that we had scheduled for tomorrow has been postponed, and we will be scheduling that, rescheduling that for a time in the near future. I feel sure it's going to be a virtual workshop. The workshop will be streamed such that the general public will be able to be a part of it and at least view it online. So that's what's going on in Cornelius. The other thing I would add, I've gotten a lot of questions from folks about how to access these presentations, John. So before we end the recording, I would certainly encourage you to just make that clear as to how folks can access that.
Okay, very good. Will do. Thank you, Mayor. Thanks for the update. Let's see, the town of Davidson, I know Mayor Knox could not join, but he said perhaps Jamie Justice or Karen Wichard would be on. Is anyone on from Davidson? Any calls for Davidson? Okay, moving on to the town of Huntersville. Huntersville, I know Mayor John Anarella is on the call. John, the mic's yours.
Hey, thanks, John, and thanks for having these. I think very worthwhile. Speaking towards the end, I'm not going to reiterate what some of the other speakers have already said. I do want to let everybody know that in addition to CMS having food distribution centers at Hopewell and North Meck, they're also working with Ada Jenkins and Caterpillar Ministries, as well as the city church off of 73, to have some type of distribution due to the fact that some people just can't get to these particular high schools to get food. And then obviously, as Commissioner Cotham said, they're also driving in certain communities. Also, for those people that know of anybody that uses angels and sparrows, they were overwhelmed last week with a 45% increase in people coming to them for food. And they are going to be closed for this week and this week only, so they can revamp their business model, buy some food, and start a different process next week. They are working with food pantries at Independence Hill Baptist Church and Hearts and Hands, which are both located in Huntersville. So if you know of anybody who typically uses that service, they're trying to get out and, they're trying to reach out to those people and tell them that there are other places to go, at least for the next week or so. And then something I would like to highlight as well, and I think it's kind of intuitive, but I want to reinforce, there are businesses that are hiring. So if you're using that business, it's most likely that they're hiring. So Aldi, CVS, Walgreens, Walmart, locally in Huntersville, Metrolina Greenhouse is looking for 250 people to hire. So if you're just thinking that you're going to be short-term unemployed and you want to get out there and work, there are some jobs available. I would suggest you go to each individual company's website and log in. And then finally, I wanted to brag on a company locally in Huntersville called Keller Technology. They are ramping up right now to do the respirator machines and other medical devices needed to combat this virus. So I see all of North Mecklenburg driving around, pitching in and doing what they need to do. My wife went to the supermarket today, and people there were just buying one thing of toilet paper. So, I think they're all getting an understanding of what we need to do to continue to move forward as this crisis continues. So that's all I have, and I appreciate your time.
Yeah, thank you, Mayor. Thanks for the good work that you're doing down in town of Huntersville and to all your team as well. So thank you. So now I'm going to go to the CEO of the Lake Norman Chamber of Commerce, Mr. Bill Russell. Bill, the mic's yours, sir.
Yeah, John, it's busy here too. It's a very fluid situation, as everybody's discussed. We continue to encourage our folks to support our local restaurants. We talked about this last week. There is a list of our restaurants on our website at lakenormanchamber.org. We encourage you to go out there and continue these supporting these restaurants who are having curbside, drive-through, and delivery. Some of them are doing fairly well, but with their support. We also are putting together a list of those businesses who are retail that have gift certificates and gift cards that you can purchase online. Again, on our website, lakenormanchamber.org, we have focused today on Work Lake Norman. And those are service businesses, whether it's accountants, real estate, financial, that type. So talking about what they're doing, again, we can encourage you to go online and support these particular businesses. Chamber of Commerce, we've got a board meeting today at 5:30. It is virtual. First time I've been at this chamber for 25 years. This is the first time we're going to have a completely virtual board meeting. We're probably going to see more stuff like this at the Chamber of Commerce, where seminars and programs are held virtually, whether it's through Zoom or Facebook Live, and see more of that going on. Again, as was pointed out earlier in the broadcast, we encourage you to continue to support our businesses. We're going to get through this. It's going to be a little bit of time. we got our former senator, North Carolina Senator Jeff Tart, who is putting together a list of links. We're going to be sending that out to the businesses, the best places to go for small business assistance and some of the things. It's changing daily, so we want to get out the most up-to-date information. But Jeff, along with Dale Gilmore, who is the chair of my business growth, is going to be putting that together, sort of a compendium of the best places to go for information. So again, thank you everybody for what they're doing. Please be safe. We'll get through this.
Thank you, Bill. On this slide, you can see there's the website for the Huntersville Chamber of Commerce. Jill Swain still cannot be with us. We're thinking of Jill, and I know a tough time for her personally. So her mother passed away. She made this public on Facebook. So prayers with Jill and her family. I want to say we're going to do this again on Wednesday, March 25th. You know, when I served not only as a town councilman or commissioner here for Cornelius, as well as when I served in the North Carolina House of Representatives, I always made safety and a priority for our communities, and that's really what I'm trying to do with these calls. Our frontline workers, from healthcare workers to our EMS personnel, even the custodial staffs who are having to clean up after us. I mean, these folks are making it happen. So just my hat is off to them and their families for doing that every day. We are stronger together. If you have questions or things you just want to share with us for this call, you can email lkntogether@gmail.com. And people are wanting to know where can they watch this. I share it on LKN Election Connection, which is a Facebook site. You can also follow it on Elect Bradford. That's also a Facebook site. Anyone can share this. As you see, I have Democrats and Republicans coming together on this call. When it comes to health and safety, that is not a partisan issue. So please share this around so people to see it. Thank you for joining, and we will have another update on Wednesday, March 25th. This concludes our briefing call for today. Thank you.